How it works. When paramedics encounter a patient with a traumatic injury who is experiencing significant bleeding and may require a blood transfusion, they open the app. The app already has geolocation enabled and immediately displays the exact distance between the patient's location and the nearest hospital. The paramedic begins the process by tapping the Start Time button. From that moment, the app tracks the duration of the procedure in real time, since elapsed time is a critical factor in estimating blood loss and supporting rapid clinical decision-making. Next, the paramedic moves to the eligibility section to enter the patient's information while the procedure is in progress. The form captures key details including the patient's name, heart rate, systolic blood pressure, and mechanism of injury, such as blunt trauma, penetrating trauma, or another type of injury. To help keep the paramedics hands-free during critical care situations, every field supports both manual entry and voice input. The paramedic can simply speak the information aloud, and the app automatically converts the speech into text. For a more complete clinical assessment, paramedics can open the Advanced Vitals section to record additional information such as respiratory rate, GCS or Glasgow Coma Scale, oxygen saturation levels, SpO2, age, time elapsed since injury, and estimated time of arrival at the hospital. After the information is entered, the app instantly analyzes the data and determines whether the patient qualifies for a pre-hospital blood transfusion. It calculates the shock index, which is the patient's heart rate divided by systolic blood pressure, a critical indicator used to identify potential hemorrhagic shock. Based on the collected data, the app generates a risk score along with the corresponding shock class and confidence level. It also highlights the primary factors contributing to the result, such as an elevated shock index or a high-risk injury mechanism. This allows the paramedic to understand not only the recommendation itself, but also the reasoning behind it. To further support clinical decision-making, the app displays the patient's estimated survival probability with and without a transfusion, along with the projected improvement expressed as a percentage. This transforms complex medical data into a clear and actionable insight within seconds. Once the patient is confirmed eligible, the paramedic moves to the inventory section to select an available blood unit. Each unit is displayed with important information including blood type, unique unit identification number, expiration date, and storage temperature. The app also assigns a status label such as safe, expiring, or problem to maintain full traceability and ensure compliance with cold chain requirements. Quick filters at the top of the screen allow the paramedic to instantly view how many units are safe for use, approaching expiration, or flagged with potential issues. If a suitable blood unit has not yet been loaded into the app, the paramedic can scan a blood bag directly from the onboard blood container using the device's camera. The app reads the barcode or QR code on the unit and automatically imports key information including blood type, unit ID, expiration date, and temperature data. This process removes the need for manual data entry, reduces the risk of transcription errors involving critical information, and ensures that every transfusion remains fully documented and traceable from the moment the blood unit is selected until it reaches the patient. With the blood unit selected, the paramedic is ready to monitor the patient throughout the transfusion process. The app guides the setup step by step, assisting with preparation of the line, initiation of the infusion, and real-time documentation of the patient's response. If the ambulance is equipped with a compatible smart IV pump, such as the BD Alaris ICU Medical Plum 360 or Bebron Infusomat, the app can connect wirelessly through Bluetooth or Wi-Fi. This allows the system to automatically capture infusion details such as delivery rate, volume administered, and pump alarm notifications. By eliminating manual logging, the app provides paramedics with continuous and accurate information about how the patient is responding during treatment. Using this live infusion data alongside the patient's vital signs, the app delivers real-time clinical guidance. For example, it can detect patterns that may indicate a transfusion reaction, recommend infusion rate adjustments, or suggest escalation if the patient's condition begins to deteriorate. If the situation becomes critical or the paramedic requires additional support, the app also provides an integrated voice or video communication feature. With a single action, the paramedic can connect directly with a remote physician, trauma surgeon, or the receiving emergency department team, bringing expert guidance to the patient's bedside within seconds without interrupting care or leaving the application. With the transfusion in progress and all critical systems in place, the paramedic must notify the receiving emergency department before arriving at the hospital so the trauma team can be fully prepared the moment the patient arrives. To reduce workload during high-pressure situations, the app automatically generates a pre-arrival summary that compiles all information collected throughout the encounter. This summary includes patient demographics, vital signs, injury mechanism, shock index and risk score, transfused blood unit details, infusion data from the IV pump, elapsed procedure time, and the estimated time of arrival. Before sending the report, the paramedic can review and edit the summary or add additional notes when needed. This may include information such as allergies, prior medications, or complications observed during transport. Once finalized, the paramedic taps Send Alert, and the summary is transmitted directly to the receiving emergency department system. This gives the trauma team a complete clinical overview well before the ambulance arrives, allowing them to prepare resources and personnel in advance. If the ambulance enters an area with limited network coverage and a connection is unavailable, the app automatically stores the alert and places it in a secure transmission queue. The summary is sent automatically as soon as connectivity is restored, and the paramedic receives updates regarding the delivery status. This ensures that critical information is never lost, even in remote environments, and helps guarantee that the receiving emergency department receives patient information at the earliest possible opportunity.